Okay, I think we'll make a start. So I'm Charlotte Clark. I'm from St George's University of London. I've got a background in psychology and epidemiology, and I'm going to talk to you today about public health impacts of environmental noise. Just to encourage you all, I'm going to, if you want to put questions in the Q&A or in the chat, and at the end we'll try and get some answers for your questions. And just to make you all aware, this is being recorded. So to start with, I'm going to talk about why is noise an important public health issue. I think it's fair to say in the 20 years I've worked in this field, really, we've gone from quite a lot of skepticism when we used to talk on this topic that noise could even influence health, now really to an acceptance that it can have an effect. And to start off, I'm just going to put up this headline. It's from the Daily Mail. This appeared back in April, and it was in quite a lot of the tabloid press about this lady who had bought her house, and it was very close to this road. She didn't like the noise. There was lots of backlash from people saying that what did she expect living here? And really, I think as a story, it just shows you the complexities of the issues around noise and health, and that people have certain expectations, people have different tolerances, and it can all be quite difficult to work through these issues within the planning processes. And so which health effects do we tend to look at in this field? Well, one that probably a lot of us have heard about is annoyance, and I'll talk more about this. People often say they're annoyed by the noise, and we treat that as a health effect, and I'll talk a little bit later about how we assess annoyance and its importance for policy. Other health effects that get a lot of attention are those on the cardiometabolic system, things like noise being associated with heart attacks and strokes, so quite serious health impacts. And also sleep, this gets a lot of attention. If you sleep poorly, you also get other effects on your health. Good sleep's good for your health, so that becomes an important outcome. But over the past 20 years, we've also started to look at a lot of newer outcomes. There's been work looking at the effect of attending schools near noisy roads or airports and its effect on learning. They've even been able to look at mortality. So this area really grew out of looking at heart attacks and strokes, and then also trying to see if noise influenced actual mortality. And increasing studies looking at birth outcomes, childhood mental health, and adulthood mental health. And then also more recently, we've started to see studies looking at dementia. So a lot of dementia can be caused by actual effects on the cardiovascular system. So this again is a sort of grown out of those studies looking at heart disease. And so what is the extent of the exposure to high levels of noise? These data here are from the recent European Environment Agency report from 2020. It's a really nice report for those of you who haven't seen it. And it estimates that in Europe, people exposed to levels above 55 decibels LDEN, we've got 112 million people exposed to road noise, 22 million people to railway noise, and 4 million people to aircraft noise. And then they go on to estimate that those exposures actually mean that we've got 12,000 more premature deaths each year, 48,000 new cases of heart disease, 6.5 million people suffering chronic sleep disturbance, and 22 million people suffering high annoyance. So you can see that's quite a population health impact, and that's only considering people exposed above 55 decibels LDEN. That's not to say that's where effects begin. And so this rather busy slide really is trying to describe how do we look at noise and health, how do we measure health? The top graphic really is where we try and use big data. So we're all very envious of the Scandinavians. They have these amazing health registries where actually every member of the population is on this database, and all the data in there says every time you go to your GP or the hospital, what happened to you, what you were diagnosed with, what medication you got. And increasingly these sorts of data are used related to environmental noise exposure. In the UK, we don't have that type of data. We do have data from hospitals and from your GP. It's quite messy data to use, but people are increasingly starting to use that data. And I guess the real advantages here are that you get really large samples. You also get people from across the whole range of noise exposures, and you can make these studies longitudinal. So for example, you can look at noise exposure between the year 2000 and 2005, and then you can follow it on and say who developed dementia in the 15 years after that exposure. But these data do lack what we think of as individual data on lifestyle, so you often don't know important things about other confounding factors that could explain effects between noise and health. The other way we look at noise and health is using questionnaire studies or studies that we actually design ourselves. These have the advantage that we can choose quite good measures of health, valid scales for these. We can even take biological measurements. We can ask people about other lifestyle factors, how active they are, their socioeconomic status, their diet, all these things that might be important. Again, we can make these longitudinal, and all these study types we can generally model air pollution as well. The disadvantage with the questionnaire type approach is that people can get the sampling wrong. You have to define your population, and that can be quite complex. You might not have a sample that you can generalize from. You generally got smaller samples. And actually most studies in this area don't tend to be longitudinal. So you're just assessing noise exposure and health at the same point in time. And what we do at the minute, we really use both these methods, and then we try and use meta-analyses so that we can combine the findings across the studies. And so when we think about how does noise affect health, that can be quite challenging for us to think about how do sound waves in our environment actually have a physiological effect on people. And so just thinking through some of the key aspects, if people are annoyed by noise, they feel their activities are disturbed, they start to have stress responses, so your body starts to fire off various stress hormones. If that goes on for a long time, those stress hormones have a detrimental effect on your physiologically. If you've got sleep disturbance as well, you're being awoken, you have poor sleep quality, that also leads to biological responses. So over time, you get higher levels of stress hormones, your heart rate goes up, all these things, you're sort of running your cardiometabolic system just too rich really, and that over time can lead to these harder health endpoints like a heart attack, stroke. And this slide from Thomas Munsell is a really nice overview paper, but it just really describes the different ways in which health can be influenced. There's what we call the direct pathway here. So if you have noise exposure, that can disturb your sleep. That leads to those stress responses I spoke about. There's also the indirect pathway. So if you feel your activities are disturbed or your sleep's disturbed, you might get annoyed, you might get angry. That can make you feel depressed and annoyed. And again, that leads to these stress responses. And over time, those responses increase your cardiovascular risk factors. So you'll see high blood pressure, high blood glucose, your cardiac system's working harder. And that's what over time can lead to things like obesity, hypertension, which is high blood pressure, and insulin resistance. And there's increasing evidence as well. We're starting to look more at how these reactions influence the brain and sort of the limbic system there. And also over time, how you can actually even, these can cause your blood vessels to constrict, you get inflammation, all of which, and oxidative stress, all of which relate to later diseases of aging. So that was a quick sort of overview of the methods that we tend to use in this field. I'm now going to go through and give a brief update really of some of the effects and the evidence for noise effects on health. So I'll start with noise annoyance. And I've put, for each health aspect, I've sort of put up which bit of the system we're talking about or where the evidence is relevant. So noise annoyance is the most widely reported health and quality of life effect by communities that are affected by noise. And actually it's increasingly used by policymakers to estimate community response to noise. And it's actually assessed using a technical standard. So recently led the revision of this technical standard, which has just been revised in 2021. And the standard has two questions to assess noise annoyance. The first question A here is what we call the 5-point scale. So we ask, thinking about the last 12 months or so when you are here at home, how much does noise from the noise source bother, disturb or annoy you? And then there's a 5-point scale there from not at all to extremely. And then there's also version B, which is called the 11-point numeric scale. And that uses a slightly longer wording, and it asks you, thinking about the last 12 months or so when you're here at home, what number from 0 to 10 best shows how much you're bothered, disturbed or annoyed by the noise source. And these questions were designed so that they could be, we could compare studies across different countries, different contexts. And what we tend to do is we use an outcome that's called the percentage highly annoyed. And that, broadly speaking, is taken those who say they're very or extremely annoyed on the 5-point, and those who score about around 72% on the 0 to 10 scale, that gets transformed. So it's not a direct, there's a little bit of maths to do there to transform that. But that's how we get our percentage highly annoyed. And you'll see increasingly these exposure response functions where the noise exposure will be plotted along here, and along the y-axis you'll get the percentage highly annoyed. And this one here is actually taken from the recent work to revise the WHO guidelines, and it shows you aircraft noise LDEN by the percentage highly annoyed. Each of these shapes is a different data point from one of these studies. And the black line is actually the new line from the WHO estimating noise annoyance effects for aircraft noise. And this red line here was the previous EU version, and the green was a later version from 2009. And so this shows you really some of the difficulties of looking at annoyance is how the studies all vary enormously. For example, if you take 60 dB LDEN, some of the studies suggest very low levels of annoyance at that exposure, and others suggest much higher. The WHO used this type of data. They'd suggested that they were going to set a guidance that 10% of the population was about an acceptable level of high annoyance in the population. And for this, they used this black line here, and they found that 10% was at about 45 dB LDEN. And so then if you look at their recommendation, they recommend reducing noise levels produced by aircraft below 45 dB LDEN, as they feel that above that level it's associated with adverse health effects. There's been quite a lot of controversy about particularly about the aircraft noise data from the WHO. But one of the main issues, and this comes from the Civil Aviation Authority's survey of noise attitudes in 2014, is that actually these exposure response relationships for annoyance really vary across contexts, but they're also influenced by what we call non-acoustic factors. So this graph here, which shows an aircraft noise LAQ 16 hours, and again you've got the percentage highly annoyed. This rather hidden blue line under here is their standard noise relationship with annoyance. And what they showed is that actually this curve can really move. So if you then if you plot this relationship for people who say they're noise sensitive, it goes up here. If you're noise sensitive and you think you're going to get more noise next summer, so an attitudinal aspect about that exposure, you can see it goes even higher. And the same, you can move it down. If people were not noise sensitive, it was much lower. And so there's a lot of work going on at the minute trying to understand these non-acoustic factors and how they influence these curves, because these curves get used in policy and there can be lots of debate about what the true answer is, and it can all get quite difficult to untangle. So moving on to thinking about the effects of children at school, I started out working on the Ranch project, which was a big EU project where we conducted exactly the same study in schools around London Heathrow, Schiphol Airport in Amsterdam and Madrid Airport. And that study found that aircraft noise was particularly associated with poorer reading in those children. And I've recently reanalyzed the Ranch data in this paper just published earlier this year. And what I did there was that actually the Ranch study had grown out of two earlier studies around London Heathrow. So what I've done, because we'd used the same methods in those studies, I could combine those three studies to re-estimate the effect. This graph on the left shows you 16-hour LAEQ at the school, and this is a reading comprehension Z score. This is a continuous measure of the child's reading comprehension. And what we found in Ranch, and the original Ranch looks very similar to this, is that as aircraft noise increased at the school, the performance on the reading test went down. And actually the average is a score of 0 on this test, and you can see reading tended to fall below average, sort of around 55 to 57 decibels. But I'd realised in the years since we published that quite often people wanted a score of reading that were perhaps was a bit more understandable, a bit more accessible. So in the reanalysis, I actually also estimated the effect for having below average or well below average reading score. And so here you can see that as aircraft noise in the school increased, your chances, the probability of you having a below average or well below average reading score increased. And all of these analyses, I should say, across all the health studies that I'm going to present, they all adjust for socioeconomic status, which can influence both your noise exposure, your health, and also your cognitive abilities. So we try and adjust for a number of those aspects. And a lot of the later studies also take air pollution into account, as well as another co-exposure that could be accounting for those effects. And we don't adjust here for air pollution. So coming back to thinking about cardiometabolic disorders, things like heart attacks, having a stroke, having high blood pressure, this has really been the bread and butter, really, I think, of the noise and health world for a long time. So does living in a noisy area increase your chance of cardiometabolic disorders? So most of the health outcomes are presumed to really operate through cardiometabolic health. It's the effect on that whole system that accounts for a huge number of the outcomes that we look at. This slide here shows the results from the systematic review that was undertaken by Elise van Kempen for the WHO revision of the noise guidelines. So Elise and her team collected together all the studies that had been published for the past few years that looked at different noise sources and different cardiometabolic outcomes, ranging from aircraft noise to hypertension, heart disease, stroke, diabetes, and also dying from heart disease. The graph shows you the risk ratio per 10 decibel increase in noise. And if the line crosses 1, it means there isn't a significant effect. But if it doesn't, so for example here, for heart disease, that meta-analysis showed that there was a significant increase in your risk for having heart disease, both for aircraft noise and also for road traffic noise, when you combine the findings across studies. There was also evidence for road traffic noise having an effect on stroke and also on diabetes. And I think there's been a few updates to these data since, showing a fairly similar findings. The ones where there aren't effects, it really tends to be that there's probably not enough studies as yet. And I think over time we'll see this evidence strengthening for some of those other outcomes. So what does it all mean? If we take this finding here for road traffic noise and ischemic heart disease, Elise plotted that relationship out. So road traffic noise in LDEN here, and your risk for heart disease up the y-axis. And this data was pulled from 3 cohort studies and 4 case control studies. And it's the black lines actually the one to look at here. And that shows you as the LDEN for road traffic noise increases, so does your risk of heart disease. The circles are the different size of different samples at that exposure level in her data set. And the conclusion was that a 10 decibel increase in road noise increased your risk for heart disease by around 8%. And the confidence interval around that estimate is from 1 to 15%. So the true estimate lies somewhere between 1 to 15%. And that's about what other updates to this has found since. So I think for cardiovascular disease, the effects are definitely there for effects of road noise. The effects are quite small. If you compare these effect sizes to other risks for heart disease, they're much smaller. But that doesn't mean they're not important. There's still a lot of people exposed to road noise, and we're continually seeing this relationship when we look at these different data sets. And then just the last study on cardiometabolic outcomes is there's increasing evidence. So there's been increasing interest in dementia for the past sort of probably 10 years, and there haven't been that many studies. The evidence really varied across studies. And this recent study, actually published in the British Medical Journal last month, looked at exposure to traffic noise and risk of dementia. It's by Mette Sorensen's group from Denmark. They have this great Danish registry data. So every time someone goes to the doctors or has some sort of health record made, that data is all available. Really for dementia, you're looking at this sort of, you would expect vascular dementia to show the effect the most, because that's associated with the blood vessels to your brain being impeded, and that's the cause. The figures here, so the top one is road traffic noise and the bottom one is railway noise. And so what they do is they look at your mean exposure to those noise sources for 10 years, and then they follow on to see who in the time after that developed dementia. So quite a nice design, because you're separating the exposure from the outcome, from the poor health developing. They had 2 noise estimates. So for everyone in Denmark, they've estimated their noise at home for the most exposed facade, which is in the purple, and for the least exposed in the yellow. And what you can see is that as noise goes up, the odds, the risk of you developing dementia did go up slightly. And you can see that also for railway noise. And the yellow shows also an increased risk, although these wide confidence intervals here suggest they don't have that many people with very high exposure who did develop dementia. So that's why the confidence intervals are wide. And they, looking across their data, they suggested that having exposure sort of above 65 compared to being in the low 40s for these noise sources increased your risk for dementia by about 16%. So again, a fairly small increase in your risk. But most prior studies hadn't found an effect on dementia. So it's one of those areas where I think we're still going to need more studies before we can start to really understand what's happening. So next, I'm going to talk a little bit about sleep. I think anyone who gets involved in environmental impact assessments will know this is quite a contentious issue. Trying to estimate the effects of a scheme on sleep is really where this epidemiological evidence gets used an awful lot. So really we're talking about the top part of the mechanisms there. So this direct effect that sleep can have, that noise can have on sleep, but also that indirect pathway where you start to feel annoyed, and that can also influence your sleep. So I've got 2 slides on sleep. The first deals with what we call objective sleep disturbance, and this is really where we measure your sleep in quite a technical way. We put electrodes over you, we measure your heart rate, we measure your brain waves. And when we think about sleep, if you're trying to work within this area of objective sleep disturbance, it's quite helpful to understand how sleep works generally. We're all supposed to get between 7 or 8 hours sleep a night for good health, for optimum health. You go from being awake into what we call the lighter stages here, sleep stage 1 and 2, down to stages 3 and 4, which are deeper sleep. You then go up, back up, and you go through this cycle several times in the night. You'll notice you only go down to the much deeper stages in the first part of the night, really, the first 2 sort of cycles. And you have these periods of REM sleep in between, and that's when you'll be having funny dreams, but you'll also be consolidating your memory and learning and things like that. And so there have been some really nice studies. I have to say they're mostly German. I think they're all German actually, where they've put people in the labs. Actually, it's quite technical, it's expensive. You expose people to noise events and you over several nights, because obviously when the first night you put people in the lab, it's a little bit tricky how people respond. And over what they tend to do on these studies, they measure these they take all these biological measures to determine your sleep stage you're in and how it's changed. They relate it quite unusually, I should have said earlier, most studies of noise and health look at external noise levels, so they can't account for the indoor noise. We don't know about insulation most of the time. And what they find is in these studies, they're really concerned with you being at some point in this stage and then finding yourself back up at an awake or a stage 1. So that's what was known as an awakening. they find that with increasing noise exposure and noise events, you get an increased number and length of those awakenings. You get reduced slow wave sleep, so that's this part here, stage 3 and stage 4. And you also get increased heart rate and blood pressure, so you start to see the cardiovascular system changes. So that again shows you how noise might influence health in the longer term. And the WHO back in 2009 in their night noise guidelines, and the recent evidence supports this, suggests that actually night noise starts to have to cause these biological effects at around 35 dB LA max inside. So quite low levels, you start to get these responses. And these graphs here are from the recent WHO review on sleep. And I'd really recommend this. It's quite a technical paper, but for anybody grappling with noise and sleep effects, this is a really brilliant overview. And these are the most recent exposure response curves from Matthias Basner in the States. So predicting whether you're going to be here, going up to being an awake or in stage 1. And you can see this is for LAS max values for road, aircraft and railway noise. And I think one of the other things to think about sleep is that people will often say that people habituate to the noise. I think that's a little bit of an urban myth personally. Studies done, you can do these types of studies in people's houses as well, and they've shown that even people who've lived by a noisy road for several years, they still show these effects. And I think that just shows you the importance that someone doesn't have to be annoyed by noise or to think their sleep's disturbed. It could still be having an effect on them physiologically. The second type of sleep disturbance, which you'll see talked about, is about what we call subjective sleep disturbance, or often called self-reported sleep disturbance. So this is the type of measure, it's not biological, but I say to you, on a scale of 0 to 10, how well did you sleep last night? Or, you know, on a scale of 1 to 5, how well did you sleep? How long did it take you to fall asleep last night? These types of surveys tend to be done in questionnaire surveys. They tend to be related to sort of 8-hour or L-night values. And people do report sleep disturbance using these techniques. So people say that they've been woken up, for example, by aircraft noise or by road noise. They take longer to fall asleep. They also tell you they go to sleep for a shorter length of time. And generally they perceive much poorer quality of sleep. And it's also suggested that aircraft noise at the same level of exposure is associated with greater self-reported sleep disturbance than road traffic. So for example, this again is from Matthias Basner's nice review for the WHO. The black line is their new estimate. So this is your L night against being highly sleep disturbed. You can see that goes there. The red lines on these are actually the older EU curves from 2000. And that was just on there for comparison. But you can see that for road and rail, the relationships are much shallower than observed for aircraft noise, which seems to be causing more self-reported sleep disturbance. What was also interesting in the WHO paper was that the authors were able to look at these subjective sleep disturbance reports, and actually they only found the effect when the question had asked how much they were disturbed by noise. If you just asked somebody how they slept last night, the relationship wasn't there, and there's a suggestion there that actually how you ask these questions can be quite important. Both these sleep disturbance measures have their place. They're both considered fair measures of sleep disturbance, and it's not that you have to pit one against the other. the objective sleep disturbance where we measure biological responses is seen as a gold standard measure for looking at sleep, but it doesn't mean that these self-reports are not valid. Just worth remembering that self-reports can be influenced as well, I think, by non-acoustic factors. So if people have got a poor perception, say, of the airport near them or of the person operating some facility, it's possible that these sleep questions also tap into annoyance and perhaps some of those political aspects, but that doesn't mean that they're not valid questions in themselves if you accept that bias might be there. And so really just to point you towards the night noise guidelines for Europe back in 2009, they set a target for nighttime noise exposure that it should be 40 decibels L night outside. And the more recent WHO guidelines actually set slightly different values for different noise sources for air, road and rail. So also have a look at those. But they're all thought to be really in harmony. And I think the 40 dBL night outside is the ideal level that people are trying to work towards, but it is challenging. So in the last part of the talk, I'm going to talk briefly about the policy landscape for noise and health. And if you do any of these things, or you want to build something new to do one of these things, you're going to come up against communities, and you're going to come up against the issue of noise exposure. There's an increasing sort of lack of public acceptance really for change in noise. The picture here on the right is actually from Frankfurt Airport. Frankfurt went through a huge expansion in the past decades, seen as quite controversial by some of the local population. They used to go into the terminal, I think it was every Tuesday at 11 or 12 o'clock, and they would bang drums and cowbells and hold a really a sort of an anti-airport display demonstration. And I think what's incredible about this, they did this for not only for weeks, they did this for years, and I think they still do it now, a sign that they're unhappy with their relationship with the airport and the changes that were being undertaken to operations and runways. And I think it's also just worth thinking that there's a lot of work supported in the UK about drone deliveries, urban air mobility, and these are all new sources of noise that as a society will be exposed to. And really it's not only about loudness. I think the evidence over time has shown effects at much lower levels than we thought traditionally. We used to think these effects really didn't start until you got above sort of 50 decibels. That's been shown to not be the case. And I think it would be really interesting, and I'd encourage people to try and work with us to let's look at some of these new technologies. They might not be that loud, but they're an unfamiliar sound source. They're going to have some really interesting features, tonalities. And I think we don't really know a lot about how people might respond to these. So I'm going to start talking through the noise policy statement for England, and I apologise for people who aren't based in England. This is an example really of how noise and how the health evidence is starting to come into play. So the noise policy statement for England says that you should avoid significant adverse impacts on health and quality of life. You should mitigate and minimise adverse impacts on health and quality of life. And where possible, you should contribute to the improvement of health and quality of life. So I think we still consider this policy quite ahead of its time. It's 10 years old now, and it sets out a clear mandate there relating to the impacts on health and quality of life. It also defines and sets out what we call LOL and SOL levels. The LOL is the level above which adverse effects on health and quality of life can be detected. and the SOL is the level above which significant adverse effects on health and quality of life occur. And it sets out the theory. It doesn't set out a level. It's not like WHO guidelines. Well, they're guidelines only as well, but it sets out the sort of the theory. And so it's not the case that it will tell you this level's fine, that level's not fine. It's for every situation to define its own LOL and SOL values. I think it can be quite difficult to sort of understand how this works. It's taken from toxicology. And so it's assumed there's a level of below which there's no effects on health for noise. And as you go along, you get to the blue section here, which is where you start to see this is where effects begin. And then as you go along, the effects get more acute. And this is what you say is a significant observed effect level. Again, I think really useful concepts. I won't go through this, but it's really just to give you an example. So for the Heathrow expansion, so the third runway at Heathrow plans, it was necessary to set for aircraft noise, road noise and railway noise, to set LOL values for the day, SOL values for the daytime, and there they even set unacceptable levels, so levels that they wouldn't go above. And then you had similar for night times. And then also they have an L max level for railway noise, which actually was similar to that for the HS2 scheme. So it's really just to show you, when I've been showing you all those exposure response functions, relationships between noise and health, that's the sort of data that gets fed into these decisions about setting LOL and SOL values. However, those of you who know me know, whilst I really like the theory of LOL and SOL values, they're really challenging to identify. So for example, where you say that you go from, where does the effect start? It's not always clear in these relationships. Where does the effect become significant can really be a matter of debate and interpretation. Most LOL and SOL values actually get set using evidence relating to annoyance and sleep. But again, if you can set your levels, well, you will set levels based on some evidence. Evidence constantly changing, new findings come along. So we're really now working in quite a reactive way within noise and health. There's a huge increase in the evidence. Setting a SOL actually has tended to be tied to noise insulation policy. So it tends to be that that's significant. If you think you need to insulate it, that's significant. I don't comment on whether that's the correct approach. I'm just saying that's how it's tended to be done. And actually precedence, whilst everybody can set their own values for their own schemes, precedent has become a very powerful and restricting influence on choosing levels. Quite difficult to deviate perhaps from what's been done before, where planning has been granted on certain levels. It can be quite challenging to actually try and decrease those levels further. I think there's also increasing focus on inequalities, and actually, whilst in many ways having the freedom to set your own values is good, it could lead to inequalities between schemes, and I think that's something we need to be mindful of. We don't at all set levels for combined exposure, and actually all the evidence I've presented to you today I haven't spoken about combined exposures. The field's very much still in its infancy, I think, about combined exposures, and we don't yet have good evidence that we could plug into policy. There's also then the problem when you do set LOL and SOL values of how they relate to other guidelines. The WHO guidance, whilst not got legal clout, communities love the WHO guidance, and you can end up in huge debates with them about LOL and SOL values, and they will want the WHO guidelines, which are incredibly low and actually set for a different purpose. So it's quite a difficult area once you start trying to do this. The other way that the epidemiological evidence gets used is in the government's web tag. So if we're developing or evaluating transport schemes, web tag monetizes the costs and the benefits of any mitigation against the health impacts of the scheme. At present, the noise appraisal has evidence plugged into it for annoyance, heart attacks, stroke, dementia, and subjective sleep disturbance. This is currently under review, this evidence base, and I think it will shortly be updated, and we would hope to see, I think, a few more health impacts added in there. And also, I think over time we'll see this evolve, and perhaps it will be that we don't plug in one relationship. So we don't say, like now for annoyance, I think it uses the 2002 EU curve. It might be that we can flick and we can look at several relationships so that we can compare what the estimate might be with different health relationships. Health is increasingly coming up not only in those sort of typical WHO guidance documents that we think of, the most recent being the environmental noise guidelines for the European region, but pro-PG planning and noise dealing with good acoustic design, as well as last year's AVO acoustics, ventilation and overheating guidance. They all tackle the issue of noise effects on health and try and set good acoustical design guidance based on the evidence. And there's also the Welsh Government's Noise and Soundscape Action Plan. This is a really nice document, and it's also really innovative, and it takes a different view. It doesn't take the view just of suggesting levels or how you do good acoustic design, but it actually moves it on to placemaking approaches. So thinking more broadly about the whole sound environment, not only about noise, and thinking more holistically than thinking about one source, thinking about how you make a good soundscape as part of a placemaking approach. So I've only got one slide on interventions, the types of things you can do to mitigate these effects on health. So there's the reduce at source approach, regulating car emissions, curfews on flights, using quieter road surfaces. There's path interventions like noise barriers or insulating people's residences. They tend to be quite costly interventions. They can be quite unpopular. People don't want to look at a noise barrier often. They might not want their residence insulated. It doesn't deal with noise outside in people's gardens. That's what people will tell you on consultation. Of course, there's also other very, things that are quite difficult to do. Building bypasses is expensive. Moving flight paths, there's a whole, airspace redesign around that. And urban planning control. And I think for many countries, the urban planning control route, really the opportunities there perhaps are not open to us now as we would like. And there's some other physical interventions. So some of the evidence suggests that if you've got a quiet side to your home, that the health effects are slightly less than they are for those who don't have access to a quiet side. And there's also lots of thoughts about having access to green space, that might be good for you and reduce these effects. But I think when you look at the quantitative data evidence for that, the jury's still out. We need to study that more. I think the key thing to think about with interventions is that there's not one of these things that's the easy fix, the quick answer. If we want to have an effect if we want to reduce the health impacts of noise, we're going to be looking across all of these things. All of these things, most of these things on their own only cause a very slight change in noise exposure. So you're going to have to be combining these solutions. And it's just to say that we naturally know very little about the impact of these types of interventions on health. So we haven't ever been able to really fund studies where somebody's insulated someone's home and we look at their health and quality of life before, and then we look at it after to say, not only what does that insulation cost, but also what health impact does it have? Can we quantify those effects? And I'd really urge anybody out there who might be in the position to be using and deploying these types of interventions, that we're really desperate to try and sort of study those situations and try and move this area of the field along a little bit. So in conclusion, noise is increasingly recognised as contributing to inequalities in health, and effects are being seen at lower levels of exposure than we previously assumed. A bit like we've seen for air pollution over the years, we're seeing effects now at much lower levels perhaps than we thought we would. And although the effects of health on human health are small, and I certainly wouldn't want anyone to be going away from this seminar thinking that there are huge effects, the effects are small, they're seen consistently, and they can have important public health implications due to the sheer number of people exposed and the chronic nature of that exposure. Evidence is certainly now increased to support preventive measures such as insulation, but as I just said, there's little evidence that we're at the minute of how that impacts on health, and that's really the next step for the field. And that if we could reduce exposure, we would reduce annoyance, we'd improve learning environments for children, we'd improve sleep, and we'd lower the prevalence of cardiometabolic disease. And so hopefully I'll leave it there, and I'll come out now from my slides and look at the questions and comments that people have made and hopefully try and answer them. And if you have got anything you wanted to say, there's my email there. Feel free to drop me an email if there's something you're particularly interested in that I haven't covered today. Okay, so I see one question here from Antonio. Oh, this is a tough one, Antonio. With all the evidence available on the consequences of road traffic noise, why is the government allowing building of new residential estates facing literally 6 lanes of motorways? Well, I think this very much goes back to that first slide as well about the lady who I'd found on the Daily Mail who had that house built on what I think some of us would think would be an unfortunate piece of land. I'm not going to go into that case further because obviously the media, how the media present these cases as well, I don't know the ins and outs of that case. Increasingly, you see this a lot with railways as well, Antonio. So bits of land that perhaps you wouldn't want to build on, people are still building on. And I think that comes from the pressure, particularly in the UK, that we don't have that much land left. Why this happens, I think, is a bigger question. Increasingly, for a situation like that, you would have to use web tags. So we've moved at least now where the health effects do get calculated, they do get monetized. We'd like to see more health effects monetized than currently. I think I can't give you an answer to your question. All I can say is that we increasingly, at least health is taken into account now. I don't know that you would ever get to the situation where a health impact would stop that happening. I think engineers are always quite keen to think they can fix all of the issues. You would build it, you would say that you were going to insulate it, and that would fulfill your requirement to avoid those effects. Personally, I think there's some issues with that, but that's the policy landscape at the minute that we're working within. I see another Q&A from Hilary Notley. If we could tackle just one area, what in your opinion would it be? Oh, that's a good question, I think, and this might be too broad for you, Hilary, I think road traffic noise is really difficult area. I think many of us are exposed to it. It's quite difficult to mitigate it. And I almost feel that's the big challenge, that we're not really we're not really tackling, because we tending to, you might be lucky enough that someone would insulate you against road traffic noise. It doesn't happen that often. And I think that's a real area where we need to think about how we tackle that from all those different ways that we can try and reduce the exposure. I'm going to just go to the chat question here. How would you describe noise sensitivity, and do you think it's important to consider? Yes, I think noise sensitivity relates to our own abilities, to how sensitive we are as individuals to noise. And we're all quite good, actually. Within a population, you get a whole spread. So some people not at all noise sensitive, some people are really noise sensitive. Anybody, I think most acousticians, people working in this field, we're all quite noise sensitive. I think we're all attuned to it. And it really, if you think back to that slide I showed you with the noise annoyance on it from the survey of noise attitudes from the CAA, that showed you that when you know you're noise sensitive, that actually your annoyance is also much higher. So we know that being noise sensitive increases your health, the effects, the noise effects on health, that we know about. And it's really important that you do, I'm assuming by noise surveys you mean if we're going to look at noise and health, absolutely we should measure it. There's some quite good scales out there. The National Noise Attitude Survey also has quite a good question on noise sensitivity that I'd recommend, and we should take it into account. Another challenging one here from Julia. What's your opinion, the most urgent action from the government to reduce noise effects on health? Ooh, difficult one. Again, I think I'd probably say road traffic noise. I think we spend a lot of time thinking about aircraft noise, and the communities around airports are quite organised, which is good, and we need that. But I also just think most of us are having quite a huge dose of road traffic noise, and that one's really difficult to mitigate. And I don't have the answers for that, but I think that probably is one area where we're going to need more action over the next few years. Let me just, I'll take the question from Antonio. It might be the last one because we're running out of time. Future scenario with many more aerial vehicles flying into our cities, drones, rotorcraft, etc. Antonio raised a really interesting area about if we all do start taking shorter flights on these little planes, and if we're all having drone deliveries, what might the world sound like? I think it could be quite nightmarish. I think we're also in a place where actually the people developing the technologies, it's all very exciting and very new, and we don't want to dampen that excitement at all. But actually we know very little about how people respond. I can foresee there'll be lots of annoyance. We know from aircraft noise really that when things change, people have a much bigger reaction. So whilst you can predict annoyance levels for a certain LDEN, actually when you change someone's LDEN quite a lot, you get a much bigger annoyance reaction. And I think we don't know enough about how people are going to react to these, and that's really an area that we need to try and encourage people in. We shouldn't just accept that drones are quiet. People say that quite a lot, but actually it's all about the quality of the sound as well, and we need to really build knowledge about that. I see there's a couple more questions. I'll just answer the last questions, as I hope there's time for that. There's a question here, with the relatively constant traffic noise, do you know whether there's a study whether it's possible that people psychologically get used to it, less annoyance, and people can do activities with it? Some people certainly do say they get used to road noise, and actually all sorts of noise. You find situations where people have really high aircraft noise exposure and they don't mind it. People can habituate, but it goes back to that point that just because you're used to it, it doesn't mean it's not hurting your health. Okay, so whilst you can get used to it, you might not be annoyed. That doesn't mean that when you're sleeping and you hear noise that your blood pressure's not increasing, your heart rate goes up. You can still have those responses. So whilst you might not be getting the stress responses, biologically you're still reacting to noise. And I think that's a concern to those of us who work in the field. And just a couple more for those of you who are still here. More people are working from home. Is that likely to change the dose-response relationships? It certainly could. We know when lockdown started that people started noticing more the noise environment. People would tell you they had birds in the garden. The birds had always been there. They hadn't seen them. I think one of the things working from home has done is that it means that there's less exposure misclassification. There's always we tend in these health studies to count you as though you're in your home environment all the time. That's certainly not the case and is definitely having an effect on our estimates. I think the problem with that question, Martin, is that noise has also changed during that working from home time. So we know there were fewer aircraft noise events, for example, and for a long time there was less road traffic noise. So we certainly, at the minute, for any data that's been collected recently, we've got to be really cautious in how they get used, because those relationships are certainly influenced both by people being home more, but also in those societal change. I'm just going to go back to this question from Merv. L-night 40 dB is really low in real life conditions. When we look at the regulations of countries, we see criterion limit values like 57 outside. Wants to ask about the applicability of the WHO standards in acoustical design. Do I know of any local regulation that applies those? No, I don't. The latest guidelines are seen to be very low. They are based on the evidence. I think that's what you have to remember. Didn't provide any interim guidelines. So the previous night noise guidelines had given that 55 dBl night. I think they are challenging. And I think initially those involved in acoustical design perhaps felt that the WHO standards were so challenging and they sort of felt that was off-putting. I think we should view them as a challenge in the sense that we should try and get a little bit closer. Whether we would ever get to those levels, I agree. I think particularly for aviation noise, they're incredibly low. My advice is always for acoustical design. Could you take a couple more? Could you set your LOL values or your SOL values? Could you set them a couple of decibels lower perhaps than where you do now? These things are all going to contribute to what I spoke about at the end of those little effects to try and have a positive impact on public health. I think they are challenging. I don't think we should dismiss them, but I think there's been lots of debate about those levels. I think let's try and get acoustical design levels as low as we can. If that means that you just move a little bit initially, I think that's all going to be positive. So I'm just conscious of the time. So I think I'll try and end it there. But if anyone else has put up a question and I haven't addressed it, I will try and get an answer to you directly. So I'd just like to thank you all for coming along today. And thank you for your questions, really, really interesting and challenging questions, I think, that show you really the challenge of trying to reduce noise in our everyday environments. So thank you very much for joining me today, and I'll say goodbye.